Hi, I'm Dr. Reddy. I'm Chief Gastroenterology and a Senior Consultant here at Continental Hospitals. Now, coming to the liver diseases, which is extremely important. Liver is a very important organ for the human body. Some of the most common liver diseases are, at the end of the day, what we see in our country is from alcohol-induced liver disease, which is very common, followed by certain viral infections. These viral infections manifest in the form of hepatitis A, hepatitis B, hepatitis C, and sometimes the rare viruses like herpes virus, cytomegalovirus. So all of these things can lead to acute infections, chronic infections. Now, there are certain other types of liver infections. For example, these are called metabolic liver diseases. These are genetically mediated, and these are due to copper, iron, people being born with these enzyme deficiencies and leading to copper-induced Wilson's disease, or sometimes iron overload, what we call as hemochromatosis. But the most common liver disease, which is spreading across the world today, is also happening in our country, is called the fatty liver. Fatty liver has become not only an epidemic in major Western countries, it is also spread to India because of rising obesity in this country, rising overweightness amongst people. India today ranks as the sixth obese country in the world. As a consequence of this, people develop fat accumulation in the liver, as you could see here, and what appears to be a simple fat in the liver, unfortunately, in 20 to 25% of the patients can progress to liver scarring, what is called as fibrosis of the liver, and subsequently they can develop cirrhosis of the liver. Cirrhosis is further scarring of the liver, where the liver becomes lumpy, bumpy, as you could see here in this picture. This is cirrhosis of the liver. And subsequently, 10 to 15% of these patients, they can develop liver cancer in their lifetime. So fatty liver is extremely important, that cannot be ignored. If your doctor on the ultrasound identifies fatty liver, it is very important that you see a gastroenterologist who has the knowledge to treat liver diseases and further investigate this. Look into if there is an element of scarring. There are many new drugs which are in the pipeline to help these patients with fatty liver. And also, fatty liver is commonly happens in patients who have diabetes, who patients who have high cholesterol, apart from being overweight. So the underlying correction or management of the diabetes and management of the high cholesterol becomes very important. In fact, one of the things that we recommend in very overweight patients who have fatty liver, who have high blood pressure, who have diabetes, we call these patients having metabolic syndrome. In fact, we recommend sometimes bariatric surgery. But having bariatric surgery done, all these problems can be solved. The liver disease progression can be halted. The blood pressure can improve. The diabetes can get settled. So it's very important to devise a comprehensive therapy with a good roadmap by your consultant, and not simply ignore that this is fatty liver, just go ahead and do some exercise or just manage some diet, and then I'll see you back in a year's time. We'll be doing gross injustice because a good number of patients, just imagine, when I say this is an epidemic, we are 1.3 billion people, more than 100 million people, 100 million adults in this country already have manifestations of fatty liver. So it's a huge burden of the society. So proper attention by good specialists is very important, and diagnosis at the right time.